you for choosing the VascoCare Medical Evolution Supine Head Positioner, which has been proven to help reduce the formation of decubitus ulcers. This instructional video has been created to ensure you use the supine head positioner, the disposable covers for the supine head positioner, and the measuring tape for the supine head positioner correctly. If this is the first time you have used any of these products, it is important that you follow these instructions carefully. Each supine head positioner is individually packaged with specific details of the model and size clearly labelled on each box. There are two styles of the supine positioner. Style 1 has 3-fingered lateral supports, and Style 2 has 2-fingered lateral supports for use when endotracheal intubation is required. Each style has 3 sizes: small, medium and large. To determine the correct size of supine head positioner, please use the VascoCare disposable measuring tape, which is supplied separately, or the VascoCare reusable measuring tape, which is supplied with the supine head positioner disposable covers. The reusable tape should be wiped with alcohol swab before and after each use. The tape is placed gently around the head of the patient, using their forehead as a starting point, and from the 3 size indicators on each tape, you can establish the size of supine head positioner that is required. Please ensure you read the label on the box of the supine head positioner carefully, and that you have selected the correct style and size before opening the packaging. When you open the supine head positioner's packaging, you will find an instruction manual and 1 supine head positioner. You must read and carefully follow the supplied instructions to ensure you understand how to use the supine head positioner correctly. Please retain the instruction manual for future use. You should now inspect the supine head positioner and make sure you have the right style and size before you proceed with its use, and make sure it is damage-free. In the event that you have any queries, you can visit the VascoCare website for further information or call VascoCare helpline. On the base of each supine head positioner, you will find a unique lot number allowing for complete traceability of the positioner. Disposable covers for the supine head positioner are supplied separately. If you are using a disposable cover, please ensure it is free from any tears or damage. There is a specific disposable cover for each style and size of supine head positioner, and you can ensure you have the right cover by matching the label shown here. To correctly fit the disposable cover, you should ensure these symbols are aligned. To fit the cover, place the back of the disposable cover over the back of the supine head positioner and work your way forward. Ensure the edge of the disposable cover is not under the base of the supine head positioner. The supine head positioner is designed to redistribute the load created by the patient's head, and the opening of the positioner must be placed beneath the occipital bone at the back of the lower part of the cranium. When using the supine head positioner, please ensure it is dry. If you are using a disposable cover, ensure that the edges are not underneath the base of the positioner. Ensure that air can flow through the positioner and it is not impeded in any way. Make sure that the surface it is being placed on is dry. Ensure you examine the patient when you have the supine head positioner in place to ensure that it is correctly positioned. There are hand grips on either side of the positioner if you need to make minor adjustments for the comfort of the patient. The supine head positioner must only be used in the correct position, as shown here, and it must never be used in any other manner. It must not be placed upside down, backward, and it must not be used with the patient facing down or with the patient's head to the side. The supine head positioner must be placed flat on the operating table, with no edges over the side of the table. In the event you have any concerns or doubts on any aspect of the supine head positioner, do not use it. To ensure its safe use, it is recommended that the patient is strapped to the operating table when in use, to prevent any unnecessary movement. This product is not to be used if the patient is going to be on split levels. During the procedure, you should avoid damaging the supine head positioner with surgical instruments, and this product should not be used if it is in close proximity to where the clinical procedure is taking place. Avoid the use of this product in a vibrating environment. You should prevent pooling fluids from the patient on the surface of the supine head positioner, as this can cause maceration of the skin. You should monitor for oedema during the procedure around the supine head positioner. Be aware of electrostatic discharge from this product, and ensure that the disposable cover does not become dislodged from its correct positioning during use. Once the procedure is complete, the disposable cover can be discarded in accordance with your hospital's clinical waste procedures. The supine head positioner can be cleaned following the hospital's disinfection procedures. This product can be wiped with an alcohol wipe, or it can be washed with a standard detergent. It is not recommended that you use a disinfectant soak. This product should not be machine washed, placed in a dryer, placed in an autoclave, or gas sterilised. The supine head positioner is completely sealed, and it should be carefully inspected after each use to ensure it is not damaged in any way. If you notice this product is deformed, cracked, torn, or cut, it should be disposed of following your hospital's clinical waste disposable procedures. Some disinfectant staining may be visible, and this is acceptable. The supine head positioner is non-conductive, non-sterile, and is latex-free. This product should not be used as a head positioner for plan AP skull X-rays. Please store this product at a temperature of between 5 to 30 degrees centigrade and avoid putting heavy objects on top of this product during storage. If you used a disposable tape, please ensure it is discarded in accordance with your hospital's clinical waste disposable procedures. The reusable tape can be stored carefully for future use. VascoCare recommend that you keep sufficient stock of the supine head positioners, the disposable covers, and the disposable tapes at all times. Remember to store the instruction manual in a safe location for future reference. With correct use, the supine head positioners will greatly improve the comfort of your patients, and it will help reduce the occurrence of decubitus ulcers. Thank you for taking the time to watch this presentation and for choosing VascoCare Medical products.